各位观众大家好，今天是5月6号周四，按照之前的计划是3点钟，他们昨天发的邮件也是3点钟，但是呢，今天早上卫生厅厅长 Andrew Dix 他自己个人的 Twitter 上呢说是1点在树里，那么我呢也就临时做了计划调整，就把它放到1点钟。那1点钟呢还没有开始，可能到了1点08、09分才开始。那我赶紧先暂停一下，先给大家做一个开场白。同时呢，也要说明一下，这个今天的这个转播设备网络不是稳定，一会儿断线，一会儿没断线。但是呢，这个整个 Internet 其实是稳定的，可能这个设备可能更新或者怎么样，所以如果万一我们的实况转播出现了一些小故障的话，请大家原谅。那我们现在开始。
Thank you very much and good afternoon. So this is our COVID-19 update for the province of BC.
今天因为是1点钟开始的，
happy to be here in the Fraser Health Region
他说是今天飞沙卫生局。
Today we report 684 new cases of COVID-19 have been diagnosed in the province in the past 24 hours, one of which was an epidemiologically linked case. So that brings our total in the province to 133,619 people diagnosed with COVID-19. Of those, 153 people are in the Vancouver Coastal Health Region, 445 are here in the Fraser Health Region, 17 people live on the Vancouver Island Health Region, 52 people live in the Interior Health Region, and 27 in the Northern Health Region. That leaves us with 6,802 active cases across British Columbia, of whom 457 people are in hospital now, 154 of them in critical care or ICU. And 125,025 people have now recovered from COVID-19. We have no new outbreaks to report today, leaving us with 4 active outbreaks in long-term care assisted living or independent living, and 3 in our acute care facilities. We have 1 additional death to report in the last few days, bringing our total to 1,595 people who have died from COVID-19 in British Columbia. And as always, our condolences go out to the families, to the caregivers, and to the communities. We mourn the loss of each and every individual along with you. We have been reaching another exciting milestone, though, in our immunization program here in BC. So, sometime today, the 2 millionth dose will have been given to people in British Columbia. This is very good news. So far, as of early this morning, we've had 1,995,456 vaccines administered in British Columbia, and of those 95,868 were in people who received the second dose. Our immunizations are going up quickly, and the ages for those who are eligible for their vaccine is coming down. As of today, anyone 49 years of age and older can book their vaccine. And as well, we're continuing, as Dr. Lee mentioned, with our worker program and our outbreak response, using immunization as one of the tools. We will continue to share the latest age eligibility in our statements, and you can also go to Immunize BC, the BC CDC, or Government of BC websites to find the latest information and see where you will stand. But what I can tell you is with the vaccines that we have been receiving this week, we're now in a place where we can move very quickly down these age groups. And so the important thing is to be registered, so as soon as your age group comes up in eligibility, you'll be able to book your vaccine.
速度会加快。
Health Canada announced that
那么昨天呢，加拿大的卫生署宣布批准辉瑞对这个12岁和15岁之间儿童的使用，所以我们现在已经跟这个联邦的疫苗免疫小组委员会一起工作，然后开展如何在 BC 省开展这个儿童的青少年的接种问题。同时我也要分享
vaccine-induced immune thrombotic thrombocytopenia, or VIT, that we have seen around the world and across the country. And this was following a receipt of an AstraZeneca COVID-19 vaccination.And the person is a woman in their 40s.
有一例死亡是阿斯利康，是40岁妇女是在延安卫生局不是死亡，说错了，就是说这有一例，这个是严重的副作用，是延安卫生局。这个是我们在加拿大获得的阿斯利康疫苗，所以我们最近已经更新了这个阿斯利康的使用说明。
that can help determine if you do have this syndrome, and there is treatment. But of course, recognizing symptoms and getting treatment early is important.
所以现在只要大家有各种各样的症状、并发症出来的话，越早发现、越早及时，越能够治疗、治愈机会大。
So, while rare, the potential for this
因为这个说实话案例相当少，相当少，这个血栓的案例相当少。
Around that period of time after you've received your vaccine. So if you have had a vaccine, any vaccine, and are feeling unwell, you can call 811.
所以只要你不管打了哪一种疫苗，只要你觉得不舒服，请马上打811电话。
A persistent, severe headache,
如果比如说你持续的有这个胸痛啊、头晕啊，或者呼吸短促啊，不是或者头疼啊，或者是这个不正常的肌肉疼啊，这个一定要及早的治疗。
Be confident for those who
但是我们一定要自信的认为，这个阿斯利康以及我们其他的疫苗都是安全的，都是在这个与病毒抗争的过程中是取得很好的效果。特别是在英国，大家可以看到了他们大量的施打阿斯利康所取得全国取得的这个成绩。
In British Columbia, particularly at the time when we were managing this surge in our third wave.
所以我们现在在第3波的时候，我们一定要格外的面对，正确谨慎的面对这一波疫情。
You need to know that it is rare.
所以大家一定要清楚，就是这个一定要有信心，对我们的疫苗，就算有血栓也是比例很小很小，同时呢也是可治愈的没有生命危险的。如果及时治疗的话，所以请大家一定要有信心，对我们的疫苗，所有的疫苗在 BC 省所有的疫苗都是安全的。那么同时呢，我们现在对这个安全，这个疫苗每一个疫苗的安全都有一个继续的、持续的保持观测和所以我的朋友和我的家人都一直是施打这个阿斯利疫苗就和全球几百万、几千万人施打疫苗阿斯利康疫苗一样都很好，我们都很自信。我们始终认为这个疫苗是对人类具有保护作用的，所以我们已经要知道。 所以我们已经在接下来的所有的年龄阶段都能够接受所有的人的注册疫苗。所以同时呢，在内陆地区和北部地区有些地区的施打了疫苗之后这个疫情的急剧的变化好转。所以大家可以看到了，特别是老年人的群体我们的都看到了这个疫苗所带来的积极的效果。那么同时呢，请大家也做一个民意调查，我们在 Bc CDC 都有一个民意调查，去年这个时候也做过。那么上次他说已经接到了10几万人完 完成的调查。那么这个呢，我本人已经做过了，主要还是调查这个全球流行病1年来对你的身心，主要是心理健康问题做一个调查。这个我是插一句。
This is a huge relief to many of us, to our colleagues who are working so diligently.
所以他也说了，疫苗来了之后，对我们每一个人、每一个团队、每一个同事，都是一个巨大的放松，一下子放轻松了因为我们不希望看到医疗资源被击垮看到这个重症监护这个被占用。那么现在看看，慢慢又缓解了我插一句，现在呢，这个住院是457，重症监护154下来了礼拜一是176个重症监护，474个住院，都慢慢下降了。昨天呢，他们是发表了书面的这个更新，获得的新增数字才500多580几，所以这个都是在积极的。他也是说了，这个疫苗以及大家遵守的所有的卫生措施，都是在拯救生命。那么，如果你打了疫苗了，那就是你做了你该做的工作那么今天呢，目前为止已经200万人已经打了疫苗我们每天都在接近目标，希望大家能够继续的保持这个冲刺能够一直朝着我们的沿着我们的这个目标一直前进。同时呢，也是那个遵守我们的卫生规范。积极的锻炼身体也好，同时呢也要戴口罩，在室内的时候，同时也是鼓励大家每个人去能够打疫苗就打疫苗，所以希望大家团结一心又来了 Be kind, be safe, be calm 这个就是共同的去面对，积极度过这个疫情。那么卫生厅长再做一个简报。
Thank you very much, Dr. Lee.
有一个 Dr. Lee 就是我们的飞沙的这个 Lee， 我估计是韩国人。那么也是在过去1例死亡，24小时死亡。昨天呢，我印象里边是0死亡。已经好几天0死亡了。当然，这个第3波疫情以后，每天都是十几个，这个是这个4月12号以后18例死亡，12号以后都是2位数。
My condolences to the family, the friends, and the caregivers
4月26号居然有17例死亡等等那么现在呢，5月3号15例，当然这个都是几天的，所以现在还是应该说是0、1、2死亡。那么我们不希望看到死亡。那么今天为什么放到飞沙卫生局呢？因为主要是飞沙卫生局做了相当艰苦的工作。他说他们在这个跟踪接触工作方面做了格外的艰辛的努力。大家都知道飞沙卫生局这个感染的人数是最高的，一直是居高不下。所以呢，这个我们的防疫工作主要是跟踪接触呢一个重点之重，所以他们的这个工作花了很大的精力在这方面。所以他们今天把这个新闻简报就放到了我们的这个飞沙卫生局在做，也是表示对飞沙卫生局的重视以及感谢。所以也感谢那个李医生带领的这个公共团队所有的这个包括了这个疫苗的检测疫苗施打以及新冠检测等等。同时呢，也感谢那些在飞沙卫生局下其他的医护工作人员，特别是那些精神健康方面的医生他们的努力。那么同时呢，在飞沙沿岸的这个各个社团、各个社区的领袖们，也是感谢他们跟我们的积极配合，使得我们的这个信息能够带到社会、社团的每一个角落。那么今天呢，已经是200万个人已经接打了疫苗。那么我印象里边，整个 BC 省能够打疫苗的是420万，那几乎是一半了。所以这个波尼医生说，今天是另外一个里程碑所以他说是值得的。所以今天呢，昨天呢，省长也呼吁大家都能够来 注册就来注册就来注册。
were delivered in BC. That's a new record.
那么他也是说到了，昨天呢，一天就是又是新的记录，就是到送货送到了这个 BC 省的疫苗，又是52万支啊，这个是新的记录，一天就到达了52万支。他说，大家也看到了现在的传播的新增的数字在慢慢下降，这个也是好消息啊，这个我也有记录，从这个4月下旬什么1000多下的呢，1293，4月8号1293啊，4月12号1283，1036，774。
Because the number of people eligible is going to likely change soon, so that number will change and the number we use will change. But of the people currently eligible, and that is well ahead of where we thought we would be at this point.
好，到了4月26号以后，8月881、847、763，那么4月29号503例，5月3号835、670、686，今天是684，昨天是580几。
A regular update on the surgical renewal commitment.
那么今天他也在会给大家汇报一下这个择期开刀的这个延期和取消的这个进度以及这个情况。
And while that number is slightly down from the 511,
那么现在呢是457个人住院啊。那么他也是说一下各个卫生局的这个分布，他说这个还是太高了啊，太高了。
Of the COVID-19 first wave in
April of
2020, and the work bebeing done there is extraordinary.
那么就相当于我们去年2020年4月份的第一波疫情，也是这么多的住院情况。所以他说这样的话呢，会给医护带来格外的负担。
For patients in hospital and their families, this is an
同时
incredibly
给病
challenging
人、
time.
给医院、
We have
家
excellent
庭
healthcare
都
staff
带
in
来了
BC,
格
and
外
their
的
commitment to
困
care
难
has
和
been
挑
seen
战。
throughout the
那么同时
pandemic.
呢，我们
To support
也
our
要
healthcare
有
staff
我们
and
因为有
continuing to deliver
格
that
外优
care.
秀的这个
Several
医
health
护系
authorities have
统
been most
能
affected
够
by
使
the
得
pandemic.
能够拯救
Principally
更多的
Fraser
生
Health and
命。
Vancouver Coastal Health have reduced surgeries in the last couple of weeks. This means a number of people who are waiting for non-urgent scheduled surgeries have had their surgery postponed.
所以他
We
也
know
是说
that
到
every
了
one of
那
those
些
surgeries is
非紧
important,
急的
and we are
开
tracking
刀
every
都是在
one of them.
这个在会
A year
取消
ago,
或
when
者
we made
延
our
期，
surgical renewal
所以这个
commitment
都
to
是为了
patients, we said each of those
能够
thousands of
腾
patients
出更
would
多
get
的
their
资
surgery.
源。
And we reported in March that 95% of them had received their surgery. To be clear, our surgical
他说我们3月份
renewal
的时候
commitment
给大家
is
汇报
also
的
to
时候
each one of our patients impacted
95%
by recent
的
postponements.
该开刀的都开刀了。
As soon as the
那么
COVID
现在
pressure
呢
on
又
our
有开
hospitals
始下
reduced,
降了，这个
each of those
因为
patients
都是
will
在
get their
延
surgery
期
as，well.
主要是因为
Today
新
we
冠
can
病毒
report the
带
number
来
of
的给
surgeries
医院带来
postponed
的
from April
压力，
26th
所
to
以
May
呢
2nd
有些
was
非紧急的开刀就不得
That's
不延迟
130 in
了。
Fraser Health, 242 in Vancouver Coastal Health, and
那么
49
他
in
就是
Vancouver
说了一
Island
些
Health.
这个数字
It is important
各
to
个
note
卫
that no
生局下
surgeries
的
were
延期
postponed
开
in
刀的
Interior, Northern
延
Health,
期
or
的
the
数
Provincial
字。
Health Services Authority. This means in the period, the 2-week period from April 19th to May 2nd, a total of 819 surgeries have now been postponed. Health authorities continue to provide urgent and emergent surgeries, and where possible, non-urgent surgeries as well. And to that key point, here is the week's surgical update for April 19th to the 25th. Health authorities completed 7,103 surgeries during that week, of which 5,581 were scheduled and 1,522 were unscheduled surgeries. By health authorities, that's 1,991 in Fraser Health, 1,346 in Interior Health, 436 in Northern Health, 1,580 in Vancouver Coastal Health, 1,487 in Vancouver Island Health, and 263 in the Provincial Health Services Authority. Our indicators, many of our indicators, of course, are moving in the right direction. As I said, right now, about 44% of those eligible have had their first shot. We are moving very, very quickly in our vaccination rollout, particularly in communities such as Surrey. Getting vaccinated will not only help to protect ourselves, but will protect our loved ones and our communities.
这么多简报一直听他们在说修改这个进度越来越快。那么他也是说到了下个礼拜开始，不是1天减1岁了也可能1天减3岁了。就是说今天是他说49岁以上的人可以预约了，那有可能明天不是49了，不是48了，明天有可能是46了，就1天减3岁。这样的话呢，可能会到6月中旬就可能会第一波，大家所有的人都轮上了第一针，那么开始打第2针了。那今天的看到的一个科学的科普文章说到第2剂。第2针是多么的重要，不能说打了第1针就算了不打第2针了，一定要打第2针。
Thank you. As a reminder to reporters on the phone, please press *1 to enter the queue. You will be limited to 1 question and 1 follow-up. Please also remember to take your phone off mute. You will not be audible until your name is called. Our first question today is from Katie DeRosa, Vancouver Sun. Katie, please go ahead.
Just before Katie...
有一个人递了张纸条给他。
I apparently have misspoke again.
他是说错了一个话。我是说了这个死亡总数。
684 cases. The
死亡总数
total number is actually 694 new cases today. So
694 694不是684。
No worries. With that, Katie, are you there? Would you like to go ahead?
694不是684。
The case of the blood clot involving the woman in her 40s. How long after her vaccination did it take to for the symptoms?
这位记者问的是，这位女士发生了这么严重的这个症状是多少以后打了第1针以后多少天发生的？
Yeah, so her symptom onset was several days after, and it was around day 5 or day 6.
可能是5-6天以后。
I don't have the exact date.
我们不知道确切的天数，她不知道。
The symptoms were she followed up with her family doctor who
那么
recognized
她的
that
家
this
庭医
might
生
be
也是一
related
直在
and
跟
did a
踪
blood
她的
test.
这
So
个
there
症
is a
状
blood test, and
包
we
括
put out
血液的检
information
查
to all
等等，包
physicians
括
in British Columbia to remind them of the things to do and the symptoms to look for. So what we're talking about are clots in sometimes arteries and or veins in the body. So the pulmonary artery is a common one in the legs, in the arms, and the one that's quite unusual.
或者他说这个手臂上，那么也有可能呢是在这个中枢神经这边，所以这个呢是很少见的这个情况。特别是脑袋这个血管堵塞。
Checks for platelets, and the platelets were low, and the person was referred for treatment. So yes, it happened as it should happen, and I do want to remind clinicians that it is important to have that index of suspicion and to do a CBC, a blood test, and to check for platelets and people that you have a concern about. And I think it's a testament to the clinician thinking about it and personalized person going early for treatment or for assessment of the symptoms that she was experiencing.
也是提醒各个治疗的医生、家庭医生也格外的注意，就是要在血检的时候也检查 platelets。
preferential position towards Pfizer and Moderna.
今天又是说到 BC 省的这个阿斯利康这个一例的重要的血栓的反应
So I think the reality is right now we have a lot of Pfizer vaccine, and that's been the mainstay of our program, the Pfizer and Moderna, so the messenger RNA vaccines, and that is what we are receiving most of. We have received a really important amount of AstraZeneca that was used, as we know, over the months of March and April, when we had a very small amount of vaccine otherwise. So it has played an incredibly important part of our program. We are not expecting a lot more of the AstraZeneca to come in. So in some ways it's a bit of a moot point, but I do want to reassure those people that have received the AstraZeneca vaccine in the last few weeks and months, it is an excellent vaccine. We only have
这个
to
是
look
都
at
是很
places
好的
like the
疫
UK
苗，
to
我
see
们都可
how
以看到英
beneficial
国
it
的
has
这个
been at
情况
helping
他们
stop
都
the
打的
outbreaks
这个
that
阿
we've
斯
been
利康
seeing.
疫苗，
We've
使
used a
得
lot
疫
of this
情
vaccine to help with the
急
outbreak
剧
in
的下
Whistler,
降。
for example,
我今天
and
突然想
it
到一个
is
词
very
叫
effective
断崖
and
式下
safe.
降
So
所
we
以
do
他说
also want to make
我
sure
们的
that
本省
people
的
are
Whistler 也是
monitoring
一
for
个很
these
好的例子，
unusual
他们
and
打
rare
的都是
symptoms,
阿
and
斯
I
利
know
康
that many people
我们
have
同时呢
had a
对所
lot
有
of
的打的
anxiety about that.
是打过疫
So
苗的人
take
都
a
有一
deep
个
breath
很好
and
的
be
跟踪
reassured that this is rare,
跟踪
that
那个
physicians
工
know
作
what to
跟
do,
踪系统
and that if you
所
have
以
any
如
concerns,
果你们
that
有
you
任何
contact
的顾
your
虑
healthcare
比如
provider,
说
you
你
can
们
go
有
to the
各种各
emergency
样不
department
舒
if
服
it's
请
severe,
联
and
系
also you can
811
call
或者是
811, and we can
811
get you
他说了
assessed
或者联系
and
你们的
treated
家
if
庭医
needed.
生或者呢可以直
Our
接
next
就到
question
急
comes
诊
from
室
Richard Zussman
都可以
Global. Richard, go ahead,
他们会
please.
给你做一些评估看看是不是那个疫苗
even
所
while you
引
were
起
in
的
Surrey, that a number of people in the community continue to call for a more concerted effort for vaccinations in Surrey, doing something like we've seen in Prince Rupert or other communities in terms of opening up for all age groups across the entire city. Is that something that at this point would still be considered, considering I think it's still one of the hottest spots in the province?
It is, and we've seen a number of things happening, and especially in the high-risk communities, and we've identified those. And I know Fraser
那么
Health
这位
has
记
been
者主
looking
要
at
是
where
问的有
we
些城
need
市，
to
比如说
target
素里
people
啊，
to
有些
be
城市
immunized
他说已
and
经不
to
根
to
据
get
年龄
registered
来
and
了
get。into
那么
that
是不是你们有
immunization
顾虑
stream.
让这个
And
热
we'll
点地区在
continue to
扩
look
大？
at
那么
those
他说是的，我们
high-risk
的确是看到，所
CHSAs
以那
across
些
the province. So
重
not just in
这
in
个高
Surrey,
风险
although
的
a
地
large
区
number of
啊，
them
都
are
是对
here.
所有的年
But
龄
what
都
we
开到
have
了，都
learned,
会
of
通知
course,
他们去
is that
打
it's。a very different thing to target a community with hundreds of thousands of people versus a community with a few thousand people. So we need
他
to
说：“我
use
们
different
所有的社
strategies to
区
make
的
sure
策略也
that
不
people
一
are
样，因
able
为
to
有些
get
社区
into
才
the
几百
clinics
个
in an
人
efficient
有些
way.
社区
And I
是
know
几
Fraser
千个
Health is
人
doing a
啊，
good
我们
job
的
at
这
that,
个
an amazing
策略
job of
工作
that,
还是不一
just
样的
by the
啊。”
numbers of people who've been immunized in the next few days, and you will see that ramped up
所以
with a
大家都
focus
可以
on
看，
those high-risk communities
我
that
们
we
现在
know
还
are
是重
here,
点关注和重
particularly
点
here
的
in Surrey.
特别
They
是素里的
started
有些
today
社区。
some kiosks to get people registered and some mobile units to get people registered, and for some people that may mean even a
所以我们
same-day
也在素
appointment
里
at
的
the
有些
clinics
社
that
区
are
啊，
running
推
and
广了
running
一个
efficiently
移
here
动
in
的
the
这
in
个
the city. So
注
yes, we
册
are
点，给
continuing
大
to
家
focus
来
on
注
doing
册
what we can
同时呢，也设立
to
更
get
多
people
的这个
immunized as
clinics
quickly as possible
去
in
来
Surrey.
施打，因为这样的话是更有效率的推广，以及让更多的人能够接种疫苗。
So I think it's especially important for people in Surrey. There'll be
所
more
以他说，
information
在
later
素里，
today
特
in
别
terms of
素
the
里的人
targeting.
来
But
讲是
there is
特
going to
别
be
重要
opportunities
这个是
in
很重要的一
Surrey
个机
to
会，
be
希望
vaccinated.
大家能够
The
引
key
起
to
重视
it, absolute
尤
key
其
to
是
it is
素
to
里地
register
区的
and
人
when invited to book. And I really want to
请大
emphasize
家能
that
够
in
注
particular
册，
here in
注
Surrey,
册
but
完之后，
everywhere
我
in
们就会
BC,
尽
but
快的给大
particularly
家
in
预
Surrey,
约。
we are we've had a
今天
lot
已
of
经讲
success
了，
in
就
the
是
last
素里，
number
素
of
里为
days.
什么
As
大
I
家知道
mentioned,
吗？
the
因为素里
registration
都是
numbers,
印度人集中的地
specific
方。
efforts by Fraser Health and the
因
whole
为
community here in Surrey, the
当
efforts
然
led
了
by the，
他们
Premier
不会说
across the province. We've
Bonnie
seen
Henry 呢
an
上个礼
significant
拜
uptake
说
in the
过，
last few days
就
in
是这
registration.
个
I
现
really
象，家
encourage
里边
people to
一幢
register
房
when they
子
get a
住了
chance to book，
他
to
说
book right away.
multi generation
So because we
啊，
are
我
going to
估
be
计
able,
不
we
止
are
3 代
going
了，
to be
可能
moving through
4
the
代
age cohorts
5
very
代同
quickly,
堂，那特别
particularly
容
in
易这样的
hotspot
话呢，
areas.
容易
And
这个产
Dr.
生这
Bowden
个
and her team will be updating that through health authorities later today, particular community health service areas that are in question.
产
But
生
I
这个
think
家庭里边的
here
传
in
播。他说
Surrey,
一家庭的传。
the frontline workers have been given priority in Surrey. That's important. We're going to be giving priority to Surrey more than any
所
other
以我们现在重
large
点的
community
是
in the
把
province
素里
because
放
what's
在
happening here
用
in
重
Surrey
点
is
之重
obviously
他
significant in
说
terms of transmission,
priority
and
就是
vaccination is one
优
of the
先次
ways
序，
that
把
we
在
can
素里
address
放到
that. It's
提
not
前
the
了。
only way, though, and we all have have to continue to follow the guidance of public health.
所以希望大家打疫苗了之后也要积极的遵守我们的卫生规范。
Richard, did you have a follow-up question?
因为你自己打了，你也要戴口罩，你要遵守卫生规范。因为你身体里边有抗体了，可能你身体里边有了，你不能再传给人家。
Bump up for their second dose? Is there any consideration being given to shorten the length of time between first and second dose? And also, has there been any concerns around shingles linked to the AstraZeneca vaccine?
I'll talk about the second one. I'm not aware of any concerns about shingles linked to any vaccine, let alone the AstraZeneca vaccine. So no, shingles, as people may know, is the reactivation of chickenpox virus, varicella virus that is in one's body, and it can come when people are worn out or immune suppressed. So it is more common as we get older. So it would not surprise me that of the millions of people who've been immunized, that some of them will have developed shingles around that period of time, but not associated with the vaccine specifically that I'm aware of. And yes, we of course are monitoring the data around people's immune responses, and particularly for people who are undergoing cancer treatments, who are on immune therapy, people who are older whose immune responses may not last as long. But I think it's very important to put the one limited study in context, and what it showed was that for some people receiving cancer treatments, they don't mount as strong an antibody response after the first dose, and importantly, many of them do not mount a strong antibody response after the second dose as well, as many as 40% of the people in this small study. So what that tells us is the same thing that we've been seeing all along, that it is more important that we make sure we are decreasing transmission in our community. That better protects everybody, even people who don't mount as good an immune response, as opposed to trying to bump up individuals' personal immune response. So we need to find that balance, and so we will be continuing to offer first doses to as many people as possible, and then we will be moving on to second doses. And as with the vaccine that we have coming in, and with the decreasing of our age-based program so rapidly in the next few weeks, we will be able to move up second doses, I believe, for most people starting very soon.
Okay, our next question comes from Justin Hunter of the Globe and Mail. Go ahead, please. Justine, are you there? Justine, you might be on mute, so I'll give you one last opportunity. And if not, we're going to go to our next question. Our next question is from Shannon Patterson of CTV. Shannon, please go ahead, please.
Oh, hi, Dr. Henry. I know that the match studies are happening right now, and we're waiting results for that. If they don't find any adverse health effects, will people in British Columbia who had AstraZeneca first be automatically given Pfizer or Moderna? Will they be given a choice? Because I do think that there will be some hesitancy for some people to take a second dose of AstraZeneca today.
Yeah, a really good question, and I know some people have concerns about using that term mix and match. And
这个也是说到了第二剂和第一剂可以混打的问题。
because there may be benefits to using two different types of vaccines.
所以他说，如果混打的话，可能还会有好处。但是我们现在科学家还在研究。
do seem to have a stronger
那么我们看到的那个，现在看到有些施打的阿斯利康的反而，他们的这个身体里边的抗体会更长，浓度更高。 这个可能还是好处，但是我们现在还不知道混打到底行还是不行。但我们会这个积极的观测和跟踪世界上所有的先进的这个技术，特别是英国的这些做法。我们希望看到更多的数据。可能是在5月底，我们会考虑到这个好处还是坏处混打的好处还是坏处。
is a choice.
我们会给人这个自己选择，给大家选择。因为如果你是打了第一针打阿斯利康，第二针你想打其他的，我们都可以。这个在5月底，主要目的主要是激起身体里边的抗体，免疫系统能够聚集。所以这个是大家都有一个选择。那么我们已经在积极的观测学习研究当中。
leads to this VIT phenomenon seems to be primarily with the first dose. There have been a very small number of cases identified after dose 2, but much, much less risk. It seems that if you're going to have that immune response, it happens the first time you receive the vaccine. But we are continuing to watch that as well.
当然了，我们还在持续的观测，所以他5月底之前，现在不会做决定，是混打还是但是如果混打的话，允许混打的话，也是允许给大家有一个选择，比如说你第一针打的是阿斯利康，那第二针你不想打阿斯利康了等等等等
And also provide greater access to N95 masks that teachers and nurses have been asking for.
So I think we need to be.
那么这位记者问的是 N95 口罩的问题，特别是护士和老师们，因为空气胶囊传播的问题。
Through the air. What we are not seeing is what we call traditional airborne transmission.
他说我们没有看到这个传统意义上的这个气溶胶的传播
or through ventilation systems, and that is not the main way. We do not see that with COVID-19, except in rare circumstances where, as you say, people are indoors, where there's very poor ventilation, there's large numbers of people, where there can be lots of aerosols generated. So it is really opportunistic, I guess, for these aerosols to be in sufficient quantity with sufficient virus that it will be transmitted. That's not the usual way. We know that. We know that from how we see outbreaks happening, transmission events happening between people. So the infection prevention and control advice that we have is the same. And it means absolutely we need to pay attention to ventilation. And that's important. We've known that's important for a long time. And I think the wording, particularly on the BC CDC website, has been appropriately updated to reflect the circumstances where the risk is greater. And we do absolutely have respirators and N95 respirators for healthcare workers, and they know how to use them with the appropriate precautions in place and infection prevention and control. Point of care risk assessment in our healthcare system.
但是他说这个绝对不是说我们不要引起足够的重视不采取各种各样措施
is needed for this virus, and we see that effective use of masks in indoor settings
所以他也是我们看到了很有效的这个室内戴口罩的措施，使得这个阻止病毒的传播，这个是绝对有效的措施。
Our next question comes from Lisa Yuzda, News 1130. Lisa, please go ahead.
I'm wondering, either Dr. Henry or Minister Dix, can you talk about, you mentioned that there's more details coming later, but I'm wondering if you can give a bit more indication. You're in Surrey. We've seen the numbers stay high in Surrey. People are wondering what's being missed.
这个记者主要问的是数理的问题，为什么还有那么多？能不能详细说一下？我相信他们不会说的。
What is being missed in the message getting to people who need to have it in that community, and what is being done to try and alter that?
Yeah, I don't know that anything's being missed. We have the largest numbers of people here. They work in many of our essential workplaces. People need to work in, and some of the more high-risk workplaces are here in this part of the province. So those are some of the things that lead to transmission. We know that many people in this community live in multi-generational homes with large numbers of people in their families, and that means that transmission in the family can happen very rapidly. In terms of immunization, the immunization rates, the percentage of people immunized is actually very high here, but we need to do more because the population is larger here.
因为他说，但是呢，现在呢，树里地区的人口的这个抗体的水平很高，但是呢，树里的人口多，所以我们还是要重点的给树里进行疫苗的施打。我们也是快速的部署。希望大家可以看到，是希望社区的这个感染率慢慢下降。他来了。
Thank you so much.
这个是树里
Dr. Henry mentioned there's unique areas within Surrey and Fraser Health regions such as essential workers and sometimes very vulnerable disadvantaged populations that where it's not easy for people to get away to get the immunization or whether they're can be difficulties in terms of having protection at workplace
但是呢，同时呢，那个他们的工作场所的也有困难，能够如何进一步的阻止这个病毒的传播。
I do believe, however, it's important to remove every barrier possible to ensure that everybody registers and gets immunized as quickly as possible.
所以他说，我们也是尽快的，我也保证在树林地区的人你们我们那个克服各种各样困难，让更多的人能够更容易的注册，更容易的来施打疫苗。我也很高兴给大家能够这个给我们支持，我们也是帮助你们，希望大家能够来注册，能够让这个更多的人建立身体里边能够有抗体建立起来，能够免疫。
Supporting registrations, and this is building on the work that we've done with Gurdwaras and community organizations and partners, where we're going to outreach into different areas where we're seeing lower registration and trying to boost that up and enhance that and accelerate as quickly as possible.
这个也是菲沙地区的李医生做一个表态了树里地区这个今天说了重点关照了估计就是这个有一个记者先生说的Vancouver Center 说了那个因为树里整个城市都可以开放注册不是开放预约了不是说你几岁就几岁就可以去打了因为树里是重点地区了
Many of those education workers or anyone working in workplaces in Surrey may not live in Surrey or may not all live in Surrey. They obviously are connected to this community and to transmission in this community.
所以主要还是防止社区的传播。
All of those groups of frontline workers, and they're going to continue to be as a community focus on different groups of frontline workers, for example, grocery workers, and also focus on areas what are called hotspots we identified.
同时呢，除了树里以外，我们还有其他的一些热点地区的人，也是重点关照，让他们13个热点地区能够
doing exactly what people are asking us to do, which is to focus more vaccine in Surrey in the coming week and
在接下来的几个礼拜里边，这个疫苗重点向树里地区以及13个热点地区。
Regardless of all of those strategies, is that the people of Surrey and people everywhere else register for their vaccine.
所以希望树里的人所有能够尽快的来注册，这样的话我们给你们马上预约打疫苗。
That they get registered and they get their vaccine, and that's the message that the
所以这个也是我们省长昨天反反复复给大家讲的，给大家的信息。所以只要你住在树里，赶紧注册，赶紧我们给你预约。
Thank you. Lisa, did you have a follow-up question?
Yes, I know you did the pop-up clinics. I'm wondering, are we going to see things like, Tony mentioned, like ice cream trucks driving around doing, door-to-door sort of vaccination? And we know we're hearing that more AstraZeneca is coming
这个里边是说到了，就是我们树里地区可能会有门到门的那种服务，打疫苗，就像卖冰淇淋的那种汽车卡车。那么他说这个是用什么疫苗打？是阿斯利康还是辉瑞？他说你说的这个 ice cream 的这个小时候大家小孩那个这个冰淇淋的，他说不是那种门到门一家一家挨家户去打基本上是这个。意思不是这样的。那么我们只是希望大家能够尽快来预约。那么这样的话，主要是让大家快速的、有效的，能够来安全的通过不同的办法来这个注册。
But the door-to-door bit will be some of the things I've been hearing about today, where there's kiosks that are moving in different parts of the community to register people, and in some cases people will be eligible for vaccine that day if there's appointments available at the clinic, and there'll be means to support people to be transported to the clinic. So those are all things that we're working on. Yes, there'll be more AstraZeneca. We're looking at where it fits into the program now, and it has been an incredibly important part of our program in the last few months, but as more and more Pfizer has come in and we have our clinic system running, it may
现在呢，越来越多的这个辉瑞和莫德纳来了。那么这个其实间接回答了这个记者的问题，也就是说，其实会打辉瑞和莫德纳。
That's a single shot vaccine, and there's a lot of advantages about that vaccine.
那么他说，现在马上又批准了强生疫苗，这个强生疫苗会有很多很多的好处，特别是一针就可以了啊。同时呢，又是这个冰箱储存的要求不是很高，所以这样的话给他们施打疫苗的灵活性，提供很多的灵活性。
In the future, it's slightly different. In that getting the information into the data system and being able to titrate where vaccine goes. And we saw that when we were doing this with the AstraZeneca, that it's much more complicated to get vaccine distributed to hundreds of pharmacies versus the efficiency that we get in doing it with our clinics around the province. So yes, we are looking at how to do that, particularly for second doses once we get to that point in the next few months. But the details of that will be worked out with the pharmacies and the pharmacy associations.
所以我接下来的第二针我们会有详细的计划，特别是跟这个药房他们联合看看是怎么打，一个是混打不混打，第二个是如何部署给其他的地方、其他的诊所，比如说现在很多的药房可以打 AZ 疫苗，也就是阿斯利康啊。那么现在呢，强生也来了，那么他说我们在第二针的时候要考虑到如何去跟这些药剂师、药房合作，给大家打。当然了，第一个一定要就是说
I will say from a public health perspective, it is something I have been advocating for over a year. Absolutely. It is an important part of workers having the agency to stay home when they're sick. And we know it's an important part of preventing workplace outbreaks. This is something that we know our Premier and the government has been advocating for with the federal government. And I know I'll turn it over to the minister, but I know they have been also discussing about filling that gap, I guess, where the federal program is not working as well for people. But it is an important thing about being able to stay home. And part of our strategy around trying to support and protect workers in their workplaces, we recognized this last year that there are many workplaces where people just do not have the ability to stay home for a whole variety of reasons. They need the money, they don't have sick pay. It's not easy to stay home from certain jobs, and it is incumbent on the owners and operators of many workplaces to make sure that they keep all of their workers safe by ensuring that people who are sick are able to stay away and not pass it on and not transmit it within the workplace. And we have been focusing our work with WorkSafe BC, our environmental health officers across the province who do this on a day-to-day basis to make sure that COVID safety plans are in place to protect workers in their workplaces across the province.
这个安全卫生措施。
Very short answer, Justine, yes, and I think you can stay tuned to hear from my colleague, Surrey Newton MLA, and Minister of Labour Harry Bains, and the Premier on this question.
他说是你，请你时刻关注我的同事啊，也是一个省议员啊，这个说了就是 sick pay 的问题，就是请病假，请这个新冠病毒的病假的话，有薪假期的问题。据我知道，现在打疫苗，只要你请假打疫苗3小时可以配的，啊，也就是说雇主要给你3小时的有薪的这个假去打疫苗。
Transmission occurs, and you've seen the strategic use of vaccination over the last number of months. The priority vaccination given to people in high transmission industries such as food processing and agriculture. And so all of that is part of a strategy we need to do to reduce transmission in workplaces. And those efforts, those COVID safety plans have been in place for a while, have been key to that. But there's no question, that's why the Premier's been advocating for sick pay, a national program for sick pay, which in our view would make the most sense, and why he's made it clear that he'll be leading steps to sick
pay 是需要的，但是问题就是，比如说有些人，你怎么如何阻止这个雇员的这个比如说不诚实的问题啊，或者是其实他没有不舒服， 但是他就说我不舒服你要在家里边拿薪水又要不上班。那么如何保证这个问题？我相信政府也在考虑这个问题，所以就没有出台这个有新的这个病假政策。
So I did speak to that a little bit earlier. We have had some preliminary results, or some preliminary data, but not results yet from the UK study.
初步的一些数据我们已经有了，关于阿斯利康的这个数据他说还没有真正的结果包括英国的一些研究的结果以及联邦的研究结果。我期望呢我们能够对这个通过英国的了解，我们能够看这个我们就像我刚才说的我们也会给人们提供选择就是因为我们现在有足够的疫苗所以有些人就是打第二针的话那么愿意给他们选择就是选择。
I'm hopeful that
同时呢他说雪山的案例呢是相当少的
messenger RNA vaccine or a second dose of the AstraZeneca.
那么同时呢有些人呢打第一针打的是信使疫苗 mRNA 那么同时呢第二针希望选择打阿斯利康都可以的。那么是问的是 kiosk 就是这个柜台这个柜台就是我们比如说上飞机之前自助的登机牌就 kiosk 也就是这些。那么在书里呢有移动的这个注册机。
I'm going to talk to Dr. Lee for that one, but I think the answer is yes.
李医生来回答这个问题书里的这个注册机移动注册机。
Definitely, and we've been engaging with community leaders and
那么他说是的，我们会跟社区的一些领导们领袖们积极去能够主要是为了让更多的人来注册。
Places of worship, in fact, gurdwaras have been used through community partners, and last weekend we've done registration there and going in actually with immunizations in the coming days as well. So those will be ongoing efforts, and that'll be in addition to some of the other areas that we mentioned that are highly accessible, like malls, some of the grocery stores, etc. So yes, definitely that's an area that we are expanding very rapidly in.
等等真的，所以他说我们也是目的是让大家更多的能够无障碍的来注册快速有效的注册，因为你一注册完马上就通知你来预约了。现在看来BC 省的注册意愿不高
Perhaps Dr. Lee or Minister Dix can answer that. Thank you.
Okay, I can start. We are looking, we've taken advice, and especially this week, we've had a number of meetings. The Premier has, the Minister and I have, and I know Fraser Health has as well, with community leaders, with leaders from different groups, both here in Fraser Health, but around the province, to try and better understand how do we reach out to certain groups, because it's not just in Surrey. We certainly have seen in the Chinese community there's questions, and so it is about how do we provide the information that people need to make that choice, that decision for themselves, and then make sure that both the registration is easy and we can support people to do it, and the vaccine is accessible. So there's a whole variety of reasons, and I think it varies a little bit by different communities. We're expanding our efforts to make sure that information that people need is available in a language that speaks to them, and from people who speak to them.
来注册，然后来施打疫苗。现在看到了吗？很多人不愿意来打疫苗。
I think Dr. Henry said it well. We obviously have to continue the reaching out that's gone on really over the entire year. Ensure that our message is heard by everyone and receive feedback.
能够把我们的信息带给我们，同时也是积极的收取各种各样的回馈意见，来看我们如何服务的社区更好，让更多的人来注册。
where there were issues around transmission, I think great leadership, for example, in the South Asian community, very significant leadership in the Chinese Canadian community, but other communities as well, that have stepped up and delivered those messages around transmission, physical distancing, and all of the steps that we need to take. And we need to really double down on all of that now. And I think we've seen that, in particular this week, but in the last number of weeks, a real effort to get registrations up everywhere, particularly as you noted, in racialized communities. And I think it's starting to have success, but we've got to just continue to work. Every time someone delivers that message, whether it's on social media, in the regular media, or to people and their families and friends, we need to contact people, and if they need help to be registered, get them registered. And we otherwise encourage them to register. This is an important period. Every single person in BC, every single one is going to have access to their COVID-19 vaccine before the end of June and probably before. And I think this is the time to get registered so you can get that access as soon as possible moment. And that's particularly important to all of these efforts. And I think as well, the efforts led by the Premier this week, and listening and learning and applying what we've been told by communities as well, which has gone out throughout the pandemic, but on registration is particularly important now.
All right, we have time for one more question. For everyone listening, Dr. Henry and Minister Dix will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. Our last question today is from Tanya Fletcher, CBC. Please go ahead.
Thank you. And if we could get an answer in French from both questions, that would be great. Talking about the community outreach as online registrations curtail, are you able to quantify how successful this tactic has been so far in terms of logistics of getting shops into arms? And would you consider ditching the online approach altogether if it's running out of steam and maybe we simply register people as they get vaccinated, like the pop-up clinics did, to avoid that step?
这个呢，我是觉得记者这个是真的是记者就是要问这些我们老百姓没想到的，或者是大多数人没想到的问题。当然了，你大多数人想到的，或者是轻而易举想到的，那他没想到，所以这个记者媒体的作用还是一个。
So what that does is it puts people's names and
那么现在博尼医生也是解释了我们的注册系统怎么工作。那么他也是说到了，你注册了之后，他就会统计有多少人，年龄是怎么样，然后呢，这个在哪一个地区，那么通过这个统计呢，他们就会把这个那个疫苗根据这个数据，根据这个分布把这个货运再运过去。所以这个是大量的数据流。
to that clinic, and when you go to that clinic, all of your information is there.
他说的这个 clinic 现在不是诊所的问题，是指这个吃打针的地方叫 clinic 那么他也是说到了根据这个网上的这个所有的数据分布这个收集之后，因为你还要预约嘛，预约了之后，你预约了5月3号，他就会预约知道5月3号现在有多少人要打都是这个然后呢他就会运过去。所以他说这个我们这个系统相当复杂。他说过去几个礼拜这个系统也是不是完美无缺的，也有一些纰漏。但是呢所有的功能服务都是正常了。所以希望大家能够在线上能够，如果是线上预约、线上注册，那么这样的话呢就会无缝链接。那如果你打电话呢，还是有一些这样或那样的衔接问题。
And just the numbers, we've actually had in terms of registration 3 of our best days in the last number of weeks. I mean, in the first days, obviously, when you launch a new system, there's a lot of registrations. But we've gone from 2,001,000 on Monday to 2,179,000. It was 178,600 registrations in 3 days. And so the Premier started leading his efforts in registration, but not just the Premier, many community groups as well. So I think those efforts are very I express my appreciation for people in the media, both different language media and all of the media really who have been, I think, providing the information that's necessary. And just remind people, if you don't want to register online, you can call us at 1-833-838-2323. Je dirais que les derniers 3 jours étaient des journées parmi les journées les plus importantes en termes de registration dans la province, dans notre programme de vaccination. On a eu 180 000 nouveaux gens et personnes inscrites dans la province, qui est une augmentation importante. Il faut continuer pour mettre le double sur cette idée. Je pense que c'est important maintenant que tout le monde s'enregistre et je pense que ça va être de plus en plus possible. Donc, on peut le faire sur l'Internet, bien entendu, mais aussi sur le téléphone. Et j'encourage tout le monde de s'inscrire dans notre programme de vaccination.
今天呢，已经有200万人接种了这个新冠病毒的疫苗。这个是他说的是一个新的里程碑。
Of vaccination, a QR code will be emailed to everyone who's been vaccinated. It's not clear what this scannable code would be used for, but is this something that is being considered in BC as well?
Well, we're talking with our colleagues across the country, and as you've heard Mr. Haju explain, Canada is also working internationally to understand what a vaccine passport might be. It's not something that we've looked at specifically, a QR code, but we do have every vaccine registered in our provincial immunization registry, and that's another thing that comes with the system that we've built around it, is that you will have access to your immunization record electronically. So that's important for you to know what vaccine you received and when, what your second vaccine is as well. We have not moved ahead with how we might use something like that, and I don't believe we will be using anything like a vaccine passport in British Columbia, and I know our colleagues across the country, we've been talking about this. So whether it's for personal use, I'm not sure what the plans are in Quebec, but we are looking at making sure that people do have access and to their own information, their own health information. And I know there will be an international need for some sort of probably for a period of time until for some sort of a vaccine passport, so to speak, for international travel, most likely. Until that time, that we have people safely immunized around the world. And right now, it reflects a major inequity in access to vaccines in many countries around the world. And, you know, I know here in Canada, we're looking at how can we support immunization through things like the COVAX initiative.
因为可能 BC 省可以到时候向美国开放。向这个加拿大联邦开放，这样的话呢，我们不要打那个护照疫苗了，疫苗护照了，那只要去，人家数字名字一输入，护照号码一输入，我打没打过疫苗？但我不认为这个数据接口全球这么多国家，我觉得这个不存在。这个伯尼森可能对IT 行业还是不很熟，所以他这个解释我不认为是很对。就是 BC 省本人没问题，你走来走去，比如说我今天我要到威斯勒去旅游了那么就名字一输入一看你打过疫苗了，但不等于你到了阿省你到阿省的一个那个 Edmonton 去住，人家明说你打过疫苗吗？如果我们没有的话，他就可以去数据库查询。那如果阿省和我们 BC 省能够数据对接，那没问题。但你到美国呢？那你回中国呢？所以这里边有很大的问题，而且最方便的不是电子的，最方便的就是给你一张纸，这是证明。但是现在不知道这个现在暂时还没有清楚，这也不是我们 BC 省能够解决的。好，那么我继续。他们这个最好的。好，那么
Thanks. That's all the time we have for today. Thanks everyone for joining.
这个就结束了。我再给大家汇报一下新增呢是694个，那么 BC 省目前呢就是总数是133619个了。那么住院呢是457个，其中重症监护是154，数据是下来了昨天到今天为止呢是1个人死亡， 那么累计总数呢，他说是1595个，我前天都是1596个了，所以我不知道他是怎么算的这个可能数据有时候调整。那么同时呢伯尼医生说了，今天又一个新的这个里程碑，也就是超过200万人 BC 省的省民接种了新冠疫苗第一剂至少。好了，那么各位观众，今天的这个新冠疫情的 BC 省最新的新闻简报呢，就为大家现场转播到这儿，我们下星期一再会。祝各位网友周末愉快，安全安心，谢谢大家。